Our group chose the town of Cape Carteret to perform our community health assessment. By performing the windshield survey, Cape Carteret showed to be a small town situated in a long string of small communities, which show evidence of growth and development by offering multiple employment opportunities. Multiple military bases are located near Cape Carteret, so the population is made up of a significant number of military service members. There are many stores and available shopping areas in Cape Carteret. There are also many restaurants available to eat at with a wide range of culture. There are places providing recreation to the community members, such as gyms and aquatic centers. There are 3 military facilities in Carteret County. There is a U.S. Coast Guard station in Atlantic Beach and Emerald Isle, and a United States Marine Corps auxiliary landing field at Bogue. Carteret County is also in close proximity to Marine Corps Air Station Cherry Point and New River Marine Corps Air Station, and Marine Corps Base Camp Lejeune. Active military and retired personnel, civilian employees, and their families account for 16% of the county's population. There are affordable health care options available in Cape Carteret. There are churches of different denominations and public schools in Cape Carteret. The most recent percentage of high school students dropping out before graduation is 39.6%, with only 39.5% activities available for teens and families. There is high-income housing available, as well as median and low-income housing available as well. The key informant interview was performed on a nurse living within the community. She is an active member in one of the larger churches in Cape Carteret. She has been able to make a difference in her community through her church. One of the programs that she participates in is Mothers of Preschoolers. It is a program offered by the church which provides child care to wives of military spouses. Backpack Friends was started by Cape Carteret Baptist Church and focuses on helping children who don't have access to adequate food sources when school is not in session. Fellowship of Integrity, Strength, and Hope was also started by the church to complement other 12-step programs for individuals recovering from addiction. Based on our community health assessment, Cape Carteret has many strengths: low employment rate, higher than NC average median family income, and higher graduation and education rate, and a lower than average poverty rate. Individuals living in poverty, over 90% are under 64 years old. Our key informant, windshield, and secondary data also identified that many military families live in the civilian community of Cape Carteret. Many of these military families live below or near poverty, based on data that it takes a soldier 10 years of service and a rank of E7 to match a civilian's income. Here's a graph showing that data. Some of the actual problems identified were lack of community support for the military families, substance abuse, and lack of food programs for children. We chose the lack of community support for the military families as our priority topic because there is a gap between community knowledge and resources and the needs of this community. By meeting the military family's needs, we may also decrease substance abuse, child hunger, and bridge the cultural gap between the civilian community and the military community. The lack of community awareness is one of the contributing factors to this priority problem. Other factors are the belief that military family seeks all care from the resources provided at military bases or installations, the military culture of pull yourself up by your bootstraps, mental health stigmas that prevent families from seeking help, and lack of knowledge about the needs of military families. Ways that nursing and health professionals can intervene would be to identify stakeholders in the civilian community, provide structural support, seek out the Department of Defense and United Way, along with hospitals, primary care providers, and churches. Another intervention includes community partnership building, which would include effective communication, participation, commitment to community health, and conflict containment. Community education would also be another intervention. Family-serving professionals, which would be doctors, churches, teachers, and coaches. Friends build up a system of support. Break down cultural barriers, including language, ethnicity, race, and gender. Military family knowledge base of resources. And build positive coping skills. Another intervention would be community screening. We need to provide tools and training for the screening, identify issues affecting a child or spouse, and know how to access local and national services for referral. We can also create military-friendly communities by supporting family-friendly work arrangements, engage and network with state and local governments, and connect volunteers. We can also help intervene with direct and indirect health care of the military community, including the medical home, mental health, rehab programs, and referrals. The actual strengths and programs that serve the community are the faith-based community, which provides the MOPS, the Mothers of Preschooler Support, the Backpack Food Program for Children, and the FISH 12-Step Substance Abuse Recovery Program. Economic resources as a Tier 3 community, potential strong volunteer base, and Department of Defense and Veteran Services. The limitations of the resources are the publication or exposure of the issue, education or health literacy, transportation for referrals, lack of interest or commitment, money, and volunteers. As our Step 3 primary prevention and interventions, it would include to get the word out through pamphlets and media for community awareness. Some other things that community members can do as primary prevention is to say thank you to our military families, invite military families and spouses out to dinners or concerts, movies, volunteer, provide a helping hand, show appreciation, cook for a family, be a friend, be understanding, help make a house or home, or organize a neighborhood association to welcome and support education, and be a proud American through action and words supporting our service members. Secondary preventions and interventions include community screenings in English and Spanish for depression and anxiety by the PHN in schools, health settings, and health fairs. The PHQ-9 questionnaire is a multi-purpose instrument for screening, diagnosing, monitoring, and measuring the severity of depression. The PHQ-9 incorporates depression diagnostic criteria with other leading major depressive symptoms into a brief self-reports tool. The tool rates the frequency of the symptoms, which factors into scoring severity index. Question 9 on the PHQ-9 screens for the presence and duration of suicide ideation. A follow-up non-score question on the PHQ-9 screens and assigns weight to the degree to which depressive problems have affected the patient's level of function. The GAD-7 questionnaire is a generalized anxiety disorder questionnaire which measures feelings of anxiety on a 0 to 21 severity scale in the past 2 weeks. The PC-PTSD is a 4-item screen that was designed for use in primary care and other medical settings, and is currently used to screen for PTSD in veterans at the VA. The screen includes an introductory sentence to cue respondents to traumatic events. The author suggests that in most circumstances the results of the PC-PTSD should be considered positive if the patient answers yes to any 3 items. Those screening positive should then be assessed with the structured interview for PTSD. The screen does not include a list of potentially traumatic events. Tertiary prevention and interventions would include working with local, state, and federal stakeholders to provide in-house rehab facilities for mental health and substance abuse, to establish domestic violence shelters, and for our outpatient treatment of mental health disorders such as anxiety and depression. Here are references for Group 6 final presentation for the Community Health Assessment. Thank you.